Measles is back, and that is not a sentence any physician wants to say in 2026. Because for years, many families were taught to think of measles as an old disease, a childhood illness from another generation, something that belonged to history textbooks, not modern homes, schools, airports, clinics, and communities. But that false sense of safety is exactly what makes this moment so dangerous. The truth is that measles never disappeared as a biological threat. What disappeared, in many places, was our respect for how quickly it spreads when immunity falls. I'm Dr. Daniel Wilson, and I work in preventive medicine and infectious disease education, with a special focus on family health, outbreak prevention, and public health risk communication. If you have not subscribed to the channel yet, subscribe now, press the bell icon, and share this video with the people you care about, because this is one of those health topics where one conversation in one family can genuinely prevent suffering in another. What concerns me right now is not just the number of cases being reported, it is the pattern behind those cases. A lot of people hear that measles cases dropped in one region compared with the previous year, and they immediately relax. They assume the danger has passed. That is not how outbreak biology works. A disease can fall from a previous surge and still remain a serious public health threat if the underlying conditions that cause the outbreak are still there. And in the case of measles, those conditions are still very much present. Immunity gaps, delayed vaccination, misinformation, missed boosters, patchy public confidence, and communities where not enough people are protected at the same time. This is the point I want to make as clearly as possible. Measles does not need many opportunities. It only needs one infected person walking into the wrong room at the wrong moment. One traveler, one classroom, one waiting area, one family gathering, one under-vaccinated community. That is why measles is such an efficient outbreak virus. It is not just contagious, it is extraordinarily contagious. If the right protections are not in place, one case can turn into many very quickly. And what makes this so frustrating from a public health perspective is that this is not a mystery disease. We know what measles is. We know how it spreads. We know what it can do. And we know how to prevent most outbreaks. Yet, every few years, the same vulnerabilities open again, and the virus finds them. Now, I want to slow down and explain why measles matters more than many people realize. Some people still think of measles as nothing more than a rash and a fever. That is one of the most dangerous misunderstandings in modern health communication. Yes, measles often begins like a viral illness, fever, cough, runny nose, red, inflamed eyes. Then the rash. But what worries me is not the rash. What worries me is what can happen around it. Dehydration, ear infections, pneumonia, hospitalization, encephalitis, severe immune disruption, and in some cases, death. And there is another piece that most people never hear enough about. Measles can weaken the immune system in a way that does not end when the rash fades. It can damage the immune system's memory, leaving the body more vulnerable to other infections for months, sometimes much longer. So, when I talk about measles risk, I am not talking about a simple, self-limited inconvenience. I am talking about a virus that can leave a child, or in some cases an adult, more exposed long after the visible symptoms are gone. Now, let me explain why this matters in 2026. The problem we are seeing globally is not only active transmission, it is the buildup of people who remain susceptible. Every time routine vaccination is delayed, every time people miss the second dose, every time trust is eroded by false information, every time communities assume coverage is probably good enough, the immunity wall becomes weaker. And measles is exactly the kind of virus that takes advantage of weak walls. Many people ask me, if this disease is vaccine preventable, why are we still talking about it? The answer is simple. Because protection only works when enough people actually have it. Measles is not impressed by good intentions. It is not slowed down by vague awareness. It is not controlled by isolated families doing the right thing while entire communities remain underprotected. This is why vaccination coverage matters at the community level, not only at the individual level. When public health experts say that communities need around 95% two-dose coverage, that is not a symbolic target. That is not a bureaucratic number. That is the threshold that helps block widespread transmission. Once coverage falls below that level in enough places, measles begins to find oxygen again. And that is exactly what many countries are still dealing with. I also want to speak directly about adults because this is another mistake I see. Too many people assume measles is only a childhood issue. It is not. Adults can become infected. Adults can become very ill. Adults can spread it. Adults who are uncertain about their vaccine history. Adults who were never fully vaccinated. Adults who belong to communities with low coverage. And adults who travel internationally can all be part of the outbreak chain. So this is not just a conversation for parents of toddlers. It is a conversation for households, workplaces, schools, clinics, airports, and multi-generational families. And this is where I think fear often gets used badly. I do not want people panicked. I want them informed. Because panic makes people impulsive. Good public health makes people precise. What matters now is not generalized fear. What matters is intelligent action. So, what do I want families to do? First, I want them to verify, not assume. Do not say, "I think my child got the vaccine." Do not say, "I'm pretty sure I had measles as a kid." Do not say, "I must be covered." This is the wrong time for vague memories. Check records, check vaccine cards. Ask your clinician. Confirm what is documented. Second, understand the difference between personal comfort and population safety. I often hear people say, "There aren't many cases where I live." That may be true today. It may not be true next month. Outbreaks do not announce themselves politely in advance. By the time many communities start paying attention, local transmission may already be underway. Third, if someone in your household develops a high fever with cough, runny nose, red eyes, and then a rash, especially after travel or known exposure, do not casually treat that as just another virus. Call ahead before going to a clinic or emergency department so staff can guide you properly and reduce exposure risk for others. This is an important public health habit. A waiting room should never become an amplifier. Fourth, be careful with misinformation that sounds polished but is built on false confidence. One of the reasons measles keeps returning is that confident misinformation spreads faster than thoughtful explanation. A short video, a dramatic post, a misleading anecdote, a false claim that the disease is harmless, a false claim that immunity is automatic, a false claim that vaccine schedules do not matter. These things create real harm when they lower community protection. And fifth, remember who is most vulnerable when measles spreads. Infants who are too young for routine protection in many settings, pregnant women, people with weakened immune systems, individuals receiving cancer treatment, people with conditions that prevent vaccination. Measles outbreaks are not just about the people who choose risk. They are also about the people who inherit that risk because the people around them failed to maintain community protection. I also want to make one more clinical point. Not every outbreak signal looks dramatic at first. Sometimes it starts with a single imported case, then a small cluster, then a school, then a healthcare exposure, then multiple contacts, then public anxiety, then emergency messaging. This is why early awareness matters. Measles is the kind of virus where delay gives it an advantage, and I think this is the deeper message that every family needs to hear. Public health does not fail all at once. It softens quietly. A missed vaccine here, a delayed dose there, reduced trust, lower uptake. A few years of disruption, a few years of complacency, then suddenly a disease people thought belonged to the past is back in the present. So, if you are watching me today, I do not want you to leave this conversation with panic. I want you to leave it with clarity. Measles is not gone. The risk is real. The danger is highest where immunity gaps persist. The people most likely to suffer are often the ones least able to protect themselves. And the solution is not confusion, not politics, not online noise. The solution is informed prevention, verified records, strong community coverage, and rapid response when warning signs appear. Here is what I would tell every family to do this week. Review your household vaccine records. Make sure children are up to date according to local guidance. If you are an adult and you are unsure of your status, clarify it with your healthcare provider rather than guessing. If there is an outbreak alert in your area, pay attention early, not late. If symptoms appear after travel or exposure, call before showing up to a clinic. And if someone around you is minimizing measles as just a rash, understand that they are underestimating a virus that public health experts take seriously for very good reason. The reason I am making this video now is simple. People always care about measles after an outbreak becomes obvious. I want people to care before that happens. That is what prevention is. Prevention is not dramatic. It is often quiet, administrative, and easy to postpone. But when it is neglected, the consequences are very real. So no, measles is not just an old childhood disease. It is a current outbreak risk that returns wherever immunity becomes uneven. And in 2026, the smartest response is not disbelief. It is preparation. If this video helped you understand the issue more clearly, subscribe to the channel, turn on notifications, and share it with family, parents, grandparents, teachers, and anyone who still thinks measles is a problem of the past. I'm Dr. Daniel Wilson, and I'll see you in the next video.